Good afternoon, folks. This afternoon's topic A is the article is End of Life Advice: How to Bring Your A Game as a Patient. Okay, so give me a few minutes to put my gear on, set up for the show. Be right with you, folks. All right, so we started. Title: End of Life Advice: How to Bring Your A Game as a Patient. Okay. And the author is Kim Fellner. Offers a deeply personal and practical guide for patients navigating terminal illness, especially in the context of modern patient-centered care, drawing from her own experience with metastatic Ewing sarcoma. Fellner reframes the patient's role from passive recipient to active team member and coach. Here's a breakdown based on the surrounding page content. Okay. Give me 1 second. We'll get going on that. All right. Core message: be empowered. Participant. Fellner challenges the outdated model of physician as authority and patient as passive. Instead, she advocates for patients to bring their A game. By choosing the right doctor, someone you trust and can have honest, difficult conversations with. Engaging actively in care decisions, not just following orders, but co-creating your treatment plan, building a relationship of candor and trust. She highlights her own partnership with Dr. Carlem Bodie at Johns Hopkins Sydney Memorial Hospital as a model. Contextual insights from the page. The surrounding content emphasizes patient-centered care, home wellness. Home wellness planning and caregiver support. Reinforcing Fellner's message. Care plans should reflect daily life, not just diagnosis. Physical and emotional and social well-being are parts of effective care. Flexibility and adaptation are key as conditions evolve. These themes echo Fellner's call for patients to be proactive, informed, and emotionally present in their care journey, even when facing terminal illness. Why it matters. This piece isn't just about medical advice, it's about agency, dignity, and relational care. It encourages patients to advocate for themselves, build meaningful partnerships with providers. Absolutely. Patient empowerment is a cornerstone of equitable, effective, and humane care. Drawing from the surrounding page content and your own systems levels lens. Here's a structured breakdown of why it matters. Okay, what is patient empowerment? Patient empowerment refers to the process of enabling individuals to take an active role in their health and healthcare decisions. It's about shifting from a pattern patent pat pattern paternalistic model to one where patients are informed, respected, and engaged collaborators. Why it's important. Improved healthcare outcomes or improved health outcomes. Empowered patients are more likely to adhere to treatment plans, ask questions, and report symptoms early. Studies show that when patients understand their conditions and options, they experience better physical and emotional outcomes, and enhanced trust and communication. As Kim Fellner's article illustrates, building relationship of candor and mutual respect with providers transforms care from transactional to relational. Patients who feel heard are more likely to share clinical information and participate meaningfully in decision making. Guys, you have to involve the patient when it comes to their own care. In anything, not just cancer care, but any care that somebody's going through. You have to involve them in decision making for their own. The patient has to make their own decision. You can give them options, but the patient has to make their own decisions. And in the case of end of life care, the patient's going through the person that's going through the terminal illness, they already know that the end is coming, so their focus is on what they want for end of life, and to see that they get the kind of care they're asking for. That's my feeling on that. Here's the rest of the presentation. Dignity and autonomy, especially in end of life care. Empowerment preserves a sense of agency and an identity. It allows patients to shape their experience in alignment with their values, cultural beliefs, and personal goals. 4, culturally responsive care. Empowerment is not one size fits all. It must be adapted to reflect cultural norms, language, and community dynamics. For marginalized populations, it's a tool of equity, countering historical exclusions and fostering self-advocacy. 5, systematic impact. Empowered patients can drive change, advocating for policy reform, participating in research, and co-designing interventions. It shifts healthcare from a top-down model to a participatory ecosystem. Okay, how to foster it. Co-create care plans that reflect daily life, not just diagnosis. Like I said, the person that has the terminal illness, they already know that they're, what the outcome is. What they want to do is live the rest of their life as they see fit, providing that it's within guideline. Your job as a person that cares for them is to make their life as rich as possible till the end. Respect what they want, try and do what they want for end of life care. That makes them very happy, folks. That's part of it, giving them what they want. Now, everybody that has a terminal illness, they want pain free. They want to experience pain free. They don't want to see pain at the end. They want to be pain free. Okay, so life, how to foster it. Co-create care plans that reflect daily life, not just diagnosis. Use plain language and visual tools to support understanding. Integrate myth busting and culturally adapted resources to change stigma and misinformation. Train providers and culturally humanity and trauma-informed care to support relational trust. And a big thing, when somebody's passing, they have to be able to trust the care team that they get. They have to trust the person that is coming into them every day. They have to build trust. It's not just given, guys. It has to be built. Okay, would you would you like to explore how empowerment frameworks could be embedded into your caregiver toolkit or life review prompts for rural elders? I think we could build something powerful together. Stay engaged in shaping their their own end of life experience. Now, you involve the patient, or you involve the person that has the illness as much as possible, folks. When it comes to making a decision, you give them a choice. Or in the case of things that I do, you sit down with the person when you still have time to discuss what they want. You have them take out a piece of notebook paper and write down exactly how they see things or how they want things done. That makes life for them a lot easier, knowing that somebody has taken the time to do that for them. You know, personalize it as much as you can. That's meaningful at the end for them. It really is. It makes a difference for them, having trouble to having a peaceful end. Okay. Let's see. Stay engaged in shaping their own end of life experience. It's a powerful reminder that even in the most vulnerable moments, patience can lead with clarity, courage, and connection. Would you like to explore how this framework could be adapted for culturally responsive end of life toolkits or participatory care models? I think it could spark some rich code design possibilities. All right, folks. Patient empowerment has a profound and often underestimated impact on healthcare costs. When patients are informed, engaged, and active participants in their care, the ripple effect extends far beyond individual well being. Here's a breakdown of how it plays out economically. Direct cost reductions, fewer hospitalizations and ER visits. Empowered patients tend to manage chronic conditions more effectively, reducing emergency interventions. For example, diabetes patients who understand and manage their condition well have significantly lower hospitalization rates. Empowered medication adherence. When patients understand why they're taking a medication and feel ownership over their regimen, adherence improves. This prevents costly complications and readmissions. Avoidance of unnecessary procedures. Informed patients are more likely to ask questions, seek second opinions, and opt out of low value interventions. Shared decision making reduces overtreatment, which is a major driver of wasteful spending. System level savings, better use of preventative care. Empowered patients are more likely to engage in screenings, vaccinations, and lifestyle changes that prevent disease. Preventative care is far less expensive than treating advanced illness. Streamlined care coordination. Patients who understand their care plan can navigate referrals, follow ups, and transitions more smoothly. This reduces duplication of services and administrative overhead. Reduced legislation and malpractice claims, litigation and malpractice claims. Strong patient provider relationships build on trust and transparency, lower the risk of miscommunication and dissatisfaction. This can translate into fewer legal disputes and associated costs. Behavioral economic bonus. Empowerment also taps into behavioral economics when patients feel ownership over their health. They're more likely to make cost conscious choices. That might mean choosing generic drugs, avoiding unnecessary tests, and using telehealth when appropriate. Implementation matters. To realize these savings, systems must invest in health literacy tools and culturally adapted education. Participatory care models that respect autonomy and lived experience. Digital platforms that support self management and real time feedback. Would you like to co design a cost impact matrix or case study model that maps empowerment strategies to economic outcomes, especially for aging and cognitive health interventions? I think it could be a powerful addition to your toolkit work. Healthcare systems can better support patient empowerment by redesigning care models to center autonomy culturally and responsiveness and relational trust based on the surrounding page content and your own participatory approach. Okay, guys, so that is A for you. I'll be back on with B shortly. Give me a bit for B, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.